Well, there have been two major updates with COVID-19 vaccines. Kids ages 5 to 11 can now receive the vaccine. Boosters for Pfizer, Moderna, and J&J are now available. In today's To Your Wellbeing, we're talking all things vaccines. We're answering your questions. Cone Health's Chief Pharmacy Officer Dr. DeAnne Brooks is joining us right now. So let's first and foremost start off with the COVID-19 vaccine for kids ages 5 to 11. Cone Health started giving the vaccine to this age group today. So how did that go?
Yes, we did, Tanya. It went really well. We are still giving vaccines right now up until 5:45 by appointment, and it went really well. We expect by the end of today, we will have given at least 100 vaccines to the age group from 5 to 11 years old of the Pfizer vaccine.
All right, so there's probably a lot of families watching right now that are wondering, okay, what do I need to make this happen? So is registration required?
Yes, appointments are required, and you can make an appointment by going to conehealth.com/vaccine, and we have a calendar that you can see where we're giving the vaccines, and you can make an appointment there.
All right, so once they make the appointment, the next thing they're going to want to do is probably talk about it. So what should parents and children expect during that vaccination process, and have steps been implemented to make the experience child friendly? I mean, because we're talking now 5-year-olds versus like teenagers from before.
Yes, so we have been preparing for this for some time, and one of the things that we have done to make this kid friendly is we have put some positive messaging out there and really made it a more fun environment. We have also set up privacy screens as well, because some children will receive the vaccine in their thigh, and so we want to make sure that they're receiving that in a private space as well. We've also worked with all of the folks who will be giving the vaccines. They have paired up and received education from our pediatric expert caregivers as well, and we always have them on site to answer any questions that may occur. And in addition to that, they should also expect that the state of North Carolina does require a consent to receive a vaccine that is under emergency use authorization. So the parents will need to accompany their child, and they will sign a consent form before giving the vaccination.
Okay, I got a couple of questions about that, especially when it comes to like grandparents and that kind of stuff who may be doing that. But my first question is about the thigh. Why are some of the children getting the shot in the thigh instead of in the arm?
Yeah, so that's a typical place that children, the younger children, will get a vaccine, and it's just simply that there's more surface area to be able to provide the vaccine in the thigh than in the deltoid of the arm where it's typically given.
Gotcha. Okay. So are the side effects kind of the same in this age group as it has been in the adults and also in the teenagers?
Yes, so the side effects are very limited. You might expect a headache, a fever, some fatigue, very similar to what we see in older children as well as adults. Sometimes you can see them a little bit more with the second dose than the first dose, but overall very limited and mild side effects.
All right, now, if your child is 11, this is always, the thing that's on that line. If your kid is 11, but they're going to have a birthday soon, should you wait until they turn 12 so they can get that more powerful adult dose?
I would not wait a moment to get the vaccine. I would get it as soon as I could, and I would go ahead and give my child the vaccine now at the dose that's appropriate for them for their age. And then if they turn 12 years old, by the time it's time to get that second dose, then they would get the higher dose.
Mm-hmm. All right. So for parents and caregivers that are still hesitant to have their child vaccinated, what would you say to them about the safety of it, about who they should talk to if they have questions?
Yeah, so I would say, I would share with them that the vaccine, just like it has been in the older children and adults, it's been proven to be very safe, and it's also been proven to be very effective as well. And the incidence of getting COVID-19 in the younger population, particularly with this Delta variant, has risen. So it's safe, it's effective, and to talk with someone, I would talk with your pediatrician and a trusted health advisor to get your information. I would stay away from the internet and like Facebook and places like that. So speak with your pediatrician and a trusted health advisor.
Yeah, the pediatrician that you take your child to all the time, that you have been trusting for the last several years with your child. Okay, so
exactly.
Let's move on to boosters. Why is a booster shot needed?
So a booster shot is needed because over time, both our natural and our natural immunity and the immunity that we get from vaccines can wane over time. And that's what we have seen in the data that's been coming out about COVID-19 as well. And so we know that for the Pfizer and Moderna vaccines, that we want to give a booster after 6 months of receiving the second dose of the vaccine. And for the Johnson & Johnson, it's recommended to give a booster at 2 months after receiving the vaccine. The Pfizer and the Moderna vaccine, they require certain folks to get the vaccine that, so people who are in the public eye a lot would qualify for getting the vaccine. If you're an older individual, you would qualify for the vaccine, for the booster vaccine. And the Johnson & Johnson, you can qualify at 2 months, and there aren't any restrictions. Anyone who received a single dose of Johnson & Johnson can get a booster dose at 2 months.
Okay, so can you mix vaccine types? Because I know that we've had some folks here who got one specific vaccine and there's not that vaccine available right now. So can you mix that?
Yes, we do have authorization now to mix the vaccines after the recipient has received their primary series. So if someone has received the first and second dose of Moderna, they can get a booster dose of any of the authorized vaccines in the United States. And that would be within 6 months. And for Johnson & Johnson, they can receive any of the vaccines within 2 months.
Okay, and side effects, are they expected to be similar to the previous experience because it's a booster shot, but it's a little bit lower of a dose than what you had the first time? Is that right?
Well, it's not always a lower dose. Only for the Moderna booster is it a lower dose, but it still shows good antibody activity. But the side effects, they're typically about the same that you hear. It's very anecdotal, but I have heard some people who have had more side effects with their booster, and just equally as many who have had no problem with their booster at all.
Mm-hmm. Okay, so if it's time for you to get your flu shot too, and I know that all of this information kind of has changed over the last couple of weeks, not even the last couple of months, but the last couple of weeks. If it's time for you to get your flu shot too, is it okay for kids and adults to receive their flu shot and the booster at the same time?
Yes, it is okay to get them at the same time. We are not giving both of them at our locations. So for example, at the Coliseum this weekend, we will be there from 9 to 5:30, giving vaccines on Saturday and Sunday. And we have plenty of appointments available, so I encourage everyone to go ahead and make your appointment now. But we only will have the COVID-19 vaccine there. But if you're receiving it within in your pharmacy or at your doctor's office, you may receive both of them.
Okay, and the one on Saturday, is it all 3 vaccines that you have, or?
Oh yes, all of the COVID-19 vaccines are free and given at no charge.
No, but I mean, you have Pfizer, Moderna, Johnson & Johnson?
Oh yes, we will have all of them at the Coliseum, and we have reserved more appointments for our pediatric patients, so the 5 to 11-year-olds.
Okay, so Dr. Brooks is going to be with us until 6 o'clock, and she's going to be answering your COVID vaccine questions. So here's how you get your question to the expert for today. You text the question. The number is 336-379-5685. 5775. And again, this is not a call, but this is a text. So text your question, and we'll be back right after this break.